Axillary fossa. The axilla is a pyramidal space situated between the upper part of the arm and the chest wall. It resembles a four-sided pyramid and has an apex, a base, and four walls: anterior, posterior in scapula, medial, and lateral. The axilla is disposed obliquely in such a way that the apex is directed upwards and medially towards the root of the neck, and the base is directed downwards. It is triangular interval bounded anteriorly by the clavicle, posteriorly by the superior border of the scapula, and medially by the outer border of the first rib. This space named apex of the axilla, that is bounded by the clavicle, superior border of the scapula, and the first rib. This space named cervico-axillary canal. The axillary artery and axillary vein and brachial plexus passing through this canal. The base. Base or floor is directed downwards and is formed by skin and fascia. The walls. Anterior walls is formed by the pectoralis major in front and clavipectoral fascia that including the pectoralis minor and subclavius, and all deep to the pectoralis major. Clavipectoral fascia is part of the deep fascia that includes the serratus, that includes the pectoralis minor and subclavius and attached to the clavicle. And pectoral is part of the deep pectoral fascia is part of the deep fascia that only includes the pectoralis major. Now, posterior wall. Posterior wall is formed by subscapularis above, terce major, and latissimus dorsi. Medial wall is formed by upper four ribs with their intercostal muscles, upper part of the serratus anterior. Lateral wall. Lateral wall, it is very narrow because the anterior and posterior wall converge on it. It is formed by upper part of the shaft of the humerus, intertubercular groove, and coracobrachialis muscles, and short head of the biceps muscles. We read about these muscles in the arm, interior of the arm in the future. Now, content of the axilla. Axillary artery and its branches, axillary vein and its tributaries, infraclavicular part of the brachial plexus. This is clavicle, this is inferior part of the clavicle. Brachial plexus. 5 group of axillary lymph node and the associated lymphatic. The long thoracic and intercostobrachial nerve, axillary fat, and areolar tissue in which the other content and embedded. The brachial plexus. The plexus consists of roots, trunks, division, and cords, and branches. Roots, trunks, divisions, cords, and branches. Roots. These are constituted by the anterior primary rami and spinal nerves C5, C6, C7, C8, and T1. Maybe in some shapes T2. But roots consist of C4, C6, C7, C8, and T1. This is anterior branches of the spinal cord that made these roots. Roots joined to each other like this. Roots of C5 and C6 join to each other. And make upper trunk. C7 long forms middle trunk. C8 and T1 join to each other and make inferior trunk. So we have superior, middle, and inferior trunk. Superior is from C5 and C6 that join to each other. Middle is from C1 alone, and inferior is from C8 and T1 that join to each other. Division is branches of this trunk. All of the trunks divided two parts: anterior, posterior, anterior, posterior, anterior, posterior. So, division of the trunks, each trunks divided to anterior and posterior, or ventral or dorsal divisions. The anterior and posterior, anterior and posterior, anterior and posterior, anterior and posterior. These divisions join and form cords as follows. Now chords. This interior from superior division and interior from middle make lateral chord. And this interior from inferior make medial chords. Chords. The lateral chords is formed by the union of the interior division of the upper and middle trunks. The medial chord is formed by interior division of lower trunk. The posterior chord is formed by union of the dorsal division of all three tongues. So you learn all of the dorsal or posterior division from the tongues make posterior. So what is our scale for this division? Why we named lateral, posterior, and medial? What is our base to this enumeration? Please, you send to me about how we named this chord to lateral and posterior and medial. What is our base to this nomination? Branches of the plexus for the upper limb. First, branches from the root. Nerve to serratus anterior, that name long thoracic. This is coming from C5, C6, and C7, long thoracic. Nerve to rhomboid. Dorsal scapular nerve C5. Branches of the trunk. Branches of the trunk. Suprascapular nerve C5, C6. Nerve to subclavius C5, C6. Branches from the chords. You learn we have lateral, medial, and posterior chords. Now you learn we have 3 branches from the lateral, 5 branches from the posterior, and 5 branches from the medial. 3, 5, 5. Branches from the chord is 3, 5, 5 from lateral, posterior, and medial. First, branches from the lateral chord. We have 3 branches. Lateral pectoral nerve, musculocutaneous, and lateral root for median nerve. This is median nerve, this is lateral root coming from the lateral cord. Okay, so we have 3 branches. We have 3 branches from the lateral cord: lateral pectoral, musculocutaneous, and lateral branches for median nerve. Branches of the medial. We have 5 branches from here. Medial pectoral, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, ulnar nerve, and medial branches for median. So this is median. Till now you learn median have 2 branches. One branches from the lateral cord, another branches for medial cord. This is very good if you know this in time, because you can recognize this nerve very soon in cadaver. By this landmark, you find median by these 2 branches from lateral and from medial. Posterior cord. Branches of the posterior cord is 5. So, upper subscapular nerve, trochodorsal, lower subscapular nerve, and radial nerve. Axillary nerve and radial. Branches from the posterior is 5. Upper subscapular, trochodorsal, lower subscapular, axillary, and radial nerve. So, you learn these 3, upper subscapular, trochodorsal, and lower subscapular. You find these 3 in the apex of the axilla. But about this one, radial and axillary, I'm speaking in the future about all of these terminal branches. Axillary artery. You know, we have 3 branches from the arch of aorta. From right to left, this is brachiocephalic, and the other we have left common carotid and left subclavian. How about right common carotid and right subclavian? Okay, you know, they derived from the brachiocephalic. This is brachiocephalic. So we have right common carotid and right subclavian. After these branches derive from subclavian that you learn in another part of the anatomy, you look at the subclavian artery. In the right and left make no difference. This artery passing posterior of the clavicle and after this named axillary. So this is axillary artery. It is continuation of the subclavian artery. It extends from the outer border of the first rib to the lower border of the tres major muscles. So it is between axillary artery is between the outer border of the first rib and lower border of the tres major. After this, it continues and name change to the brachial. But now about the axillary artery. In this slide, you can see pectoralis minor. This is pectoralis minor. The pectoralis minor muscle crosses the axillary artery passing posterior of this muscle. So divided to three parts. First part, superior to the muscle. Second part, posterior to the muscle. And third part, inferior to the muscle. So this teres minor muscle is landmark for us. This axillary artery, according to this muscle, divided three parts: superior, posterior, inferior. Branches of this muscle. Branches in the right and left make no difference. The axillary artery gives 6 branches. First from superior, second from posterior, and third from inferior. 1, 2, 3. First 1, second 2, third 3. Branches from the first part. I told you the branches derived from the first one is one branch that named superior thoracic. Superior thoracic supply pectoralis major and pectoralis minor muscles. This part is second part, is posterior. From the second we have second branches. We have 2 branches. From the second we have 2 branches. One is thoracoacromial. Thoracoacromial emerges at the upper border of the pectoralis minor, pierces the clavipectoral fascia and divided into 4 terminal branches. Pectoral, deltoid, acromial, and clavicular. And this is lateral thoracic. Thoracoacromial and lateral thoracic derived from the second part. Lateral thoracic artery runs along the lower border of the pectoralis minor. It is related to the anterior axillary lymph node. It supplies the pectoral muscles. In female, it is an important source of blood supply to the breast. Branches from the third. From the third we have 3 branches. The largest branches is this, that named subscapular artery. It runs on the posterior wall of axilla. It supplies the latissimus dorsi and the serratus anterior and terminate the inferior angle of the scapula. Look at this artery. We have one branches from this artery that named circumflex scapular, which passes through the triangular space. Circumflex scapular artery. After drive this branch from the subscapular, this is subscapular, this is circumflex subscapular. After drive this branch, named of the subscapular, change to trochodorsal. That in this pathway, this is along with the trochodorsal nerve, and these two supply the latissimus dorsi. Subscapular artery, subscapular circumflex artery. After these branches, this artery named trochodorsal. Trochodorsal is along with the trochodorsal nerve. Trochodorsal nerve and artery are along with each other that supply the latissimus dorsi. Another artery from the third part. We have these two arteries. Anterior circumflex humeral and posterior circumflex humeral. Circumflex means around anything. Here around superior end of the humerus. Anterior circumflex, posterior circumflex. These two round the neck of the humerus and anastomoses with each other. Anterior is smaller than the posterior. Anterior is smaller than the posterior. So, we have 6 branches from the axillary. From the first part 1, from the second part 2, and from the third part 3. Name of all of the 6 is superior thoracic, thoracoacromial, lateral thoracic, subscapular, anterior and posterior circumflex humeral. Please look at the direction of these branches. It is so important for your practical anatomy. In this slide, you can see subclavian, axillary, brachial artery. And from the axillary, you can see superior thoracic, thoracoacromial, lateral thoracic, subscapular, anterior and posterior circumflex humeral. Please write for me. One of the artery. What is name of the one of the artery that derive anterior of this axillary nerve? Anterior, not right or left. Anterior of this. Here you can see axillary artery. This is lateral cord. This is medial cord. This is lateral branches for median nerve. This is medial branches for median nerve, and this is median. Here you can see median is lateral to the axillary artery, that here name changed to the brachial artery. And from the lateral cord you have musculocutaneous and lateral branch to median. From the medial cord you have medial branch to median and ulnar. This thick is ulnar nerve. This is medial cutaneous nerve of forearm. It is long than this one. This is medial cutaneous nerve of arm. This is medial cutaneous nerve of forearm. Is longer than this one. In the posterior compartment of arm, you can see radial nerve. This is radial nerve, and this is cutaneous branches from the radial nerve. In this slide, you can see the situation of the median nerve and brachial. Now about the axillary vein. Here you can see two veins. That these two veins is superficial vein in the upper limb, cephalic in the radial or lateral, and basilic in the medial or ulnar part of the upper limb. In the dorsal of the hand, we have dorsal venous network. From dorsal venous network in the lateral or radial, make cephalic vein. And from this dorsal venous network, from the medial or ulnar, make basilic vein. So, we have two superficial veins in the upper limb, cephalic in the lateral, basilic in the medial. Now you learn how make these two veins. Origin of these two veins, cephalic and basilic, is from the dorsal venous network, but one of them in the lateral, another in the medial. Look at this slide. Here you can find cephalic vein. This is dorsal network vein, and this is lateral. This finger is lateral, and this is cephalic vein. This is medial, and this is basilic vein. And here, continuous of the cephalic vein and basilic vein you can see in the anterior, not in the posterior. So these two, cephalic vein and basilic vein. And here we have another vein that name antebrachial or intermediate or antebrachial vein. Here we have M shape, that named M-shaped vein, like M. From cephalic, basilic, and antebrachial. And continuous of the cephalic vein is here in the lateral, and this is continuous of the basilic vein. Look at here. Basilic vein make axillary vein. Or we can say the axillary vein is the continuation of the basilic vein. And cephalic vein here we have in deltopectoral groove, and here is continuous of the cephalic vein. The axillary vein is joined by the vena committant of the brachial artery a little above the lower border of the tres major. It lies on the medial side of the axillary artery. At outer border of the first rib, it becomes the subclavian vein, opposite of the artery. In the artery you have subclavian artery, that name changed to the axillary artery. Vein is opposite of the artery. Here we have axillary and name changed to the subclavian. There is no axillary sheath around the vein, which is free to expand during time of increased blood flow. Occasionally, a muscular band called the axillary arch overlies the vein. It may compress the vein and cause spontaneous thrombosis. In this slide, you can find how make M shape. The axillary lymph node. The axillary lymph nodes are scattered in the fibrofatty tissue of the axilla. They are divided into 5 groups, like I'm telling to you. 1. The nodes of the anterior or pectoral group. Anterior or pectoral group lies along the lateral thoracic vessels or along the lower border of the pectoralis minor. These nodes named anterior, along the lower border of the pectoralis minor. They receive lymph. Anterior nodes receive lymphs from the upper half of the anterior wall of the trunk and from the major part of the breast. The posterior nodes group lies along the subscapular vessels. Lines along the subscapular vessels. On the posterior fold of the axilla. They receive lymph from the posterior wall of the upper half of the trunk and from the axillary tail of the breast. The lateral group. Nodes of the lateral group lies along the upper part of the humerus, medial to the axillary vein. They receive lymph from the upper limb. The central group. The nodes of the central group lies in the fat of the upper of the axilla. They receive lymph from the preceding groups and drain into the apical group. They receive lymph from the lateral, posterior, anterior, and drain in the apical. They receive some direct vessels from the floor of the axilla. The intercostobrachial nerve is closely related to them. The nodes of the apical or infraclavicular group. These nodes lie deep to the clavipectoral fascia along the axillary vessels. They receive lymph from the central group, from the upper part of the breast, and from the thumb and its web. The lymphatic from the thumb accompanying the cephalic vein.